Okay, good afternoon, everyone, again. This is Kimberly Fowler from the National Council of Urban Indian Health. We thank you for joining our presentation today, our webinar. Today's webinar is on assessing trauma-informed virtual training simulation. We are the National Council of Urban Indian Health. We are a membership-based nonprofit that represents the 41 urban Indian health organizations across the nation that provide essential health and social services to American Indians and Alaska Natives living in urban settings. If you haven't already done so, please type your name and organization in the chat box located in the lower left-hand side of your screen. We'd love to hear who all is on the line. You are currently muted. If you do wish to ask a question, we ask that you place it into the chat pod or the Q&A pod, and we'll be sure to answer those at the end during our Q&A session. Today's webinar, and you can find that here located in this schematic of the Q&A pod. Today's webinar will be presented by two individuals from the Office of Juvenile Justice and Delinquency, Prevention Travel Youth Program Training and Technical Assistance Center, as well as Cognito and One Fire Associates. We're happy today to have with us Sutton King and Jamie Barges, who I'll actually let provide a little bit more information about themselves in just a couple of minutes. So those are pictures of Sutton and Jamie. For our agenda today, we do plan to identify resources and learning applications to access simulations, build motivational skills, and implementing training for staff and community. We hope to identify findings from research outcomes in tribal communities to advance best practices for use of these simulations. And then lastly, to identify accessible simulations to build motivational interviewing skills for parents of 2 to 5-year-old children. At this point, I want to give you a little bit more introduction about our team. I'll start with myself. So my name, once again, is Kimberly Fowler. I have been at NCUI for almost 7 years, working in the Training and Technical Assistance Program. And so really working to provide resources, trainings, and information and data analysis to the 41 Urban Indian Health Programs that we serve as our membership. And so we're excited today for this webinar in order to share an additional resource that will help in some of your programming, especially when it comes to being better as providers as well as staff that are working with youth in your motivational interviewing skills. We do also provide advocacy here at NCUI, making sure that the voice of American Indians and Alaska Natives living in urban settings is also heard and at the table when decisions are being made when it comes to funding and other really important initiatives that come out from Congress as well as federal agencies. And so that's a little about NCUI and who I am. I'd like to turn it over to Dr. Jamie Barges to also give her information.
Great. Thank you, Kimberly. Can you hear me?
Yes, I can.
Excellent. So hello, everyone. I'm Jamie Barges. I'm President and CEO of One Fire Associates, which is a research and evaluation firm that's committed to providing quality and culturally grounded evaluation, research, and capacity building activities, primarily with tribes and urban Indian health organizations. And our goal really is to help improve the quality of life for the people that you're serving. And I first got connected to Cognito back in 2009 when, we were really struggling with suicide epidemics across the community. And we're really struggling with keeping the human resources within the clinics and the tribal programs. and recognizing that this is a really amazing training opportunity that could help us sustain through turnover and also increase the training access for the communities. But it took us a long time before we finally found some funding that would open up access to tribes and urban Indian health organizations. And so my role really has been to support the education around it, which includes publishing and supporting some of the research activities that are going on related to how it's working with American Indian and Alaska Native populations, as well as how can we improve it in terms of the adaptation and the usefulness for a indigenous community context. So that's really my role. And my hope is that we can continue to document what's working and ensure that these simulations continue to be freely available to the urban Indian health organizations, and the data is a very important part of that. So I'm very happy that we've all come together here, and hopefully these simulations will be accessible to you all in the urban Indian health organizations and throughout your communities, and that we can continue to build the evidence and make sure that more of these simulations are available to you all in the future. So I'm going to turn it over to Sutton from Cognito, who's going to introduce herself and then start to show you what this technology is capable of.
Thank you, Dr. Barges. Hello, everyone. So I just want to first talk about who is Cognito, who we are. So here at Cognito, we believe in the power of conversation. It's the power to inspire, build knowledge, and change how people think and act. And indeed, in all of human history, there is nothing quite as important as a conversation, yet the most important conversations are usually the most difficult, and we often feel unprepared to have them. So here at Cognito, what we do is we create digital experiences that prepare people for conversations that matter the most. And so a little bit about myself. Again, my name is Sutton King, and I'm the Tribal Program Specialist here at Cognito. And through my career here, I've aided in the national implementation reporting of suicide prevention and trauma-informed evidence-based training to some federally recognized tribes. And I've spent most of my career here presenting and facilitating workshops nationally on the research supporting the use of Cognito's virtual suicide prevention and trauma-informed care training simulations in American Indian and Alaska Native communities. So again, we're so excited to have this presentation, and I'm so grateful that everyone could come together and we can talk to the simulations that are freely available to all of Indian country. So thank you for having us today. So many people may not really understand why Cognito uses virtual humans. So here I'm going to talk about why we've chosen to use virtual humans and the advantages and benefits of using virtual humans. So as we all know, the traditional approach to building conversation skills is to bring people into a room and ask them to engage in a role-play conversation. So the vast majority of people are not comfortable doing this. Knowing that they are being watched by others means that they are unlikely to act as they would in real life. Instead, they act as they believe they are expected to act. While the concept of face-to-face role-play is a good one, implementing it in a way that results in effective learning or self-assessment is very difficult, not to mention challenging to scale and also to standardize. So our research has shown that people are more comfortable engaging in practice conversations with virtual people than real people. So we feel more comfortable acting as we would in a real-life situation, and we're less likely to be defensive to hearing feedback about our approach in the conversation. So interacting with the virtual humans here increases the user's willingness to self-disclose information and a comfort level to experiment with various conversational tactics. The use of virtual humans versus in-person training exercises basically eliminates that awkwardness of the face-to-face role play and risk of embarrassment in front of your peers, which the literature refers to this as self-evaluative threat. So next, how does this work? So one, we know that deliberate practice is the most effective way to build skills, and this is no different when building conversation skills. So by allowing people to take the driver's seat in the conversation, making decisions of what to say, experience the consequences, and getting personalized feedback, we build confidence and capabilities in a way that is superior to any other format of learning. Simply put, what I like to say is no one learns to ride the bike by watching a movie of someone else doing it. Next, so Cognito's digital experiences are dynamic. So conversation paths continually adjust based on the individual user's decision. So as a result, different users can have different experiences with the same virtual human. And next, you learn the motivational interviewing skills and techniques, which many of you have heard of MI, where MI has been used very effectively in helping people to change behaviors in areas of health and behavioral health, including things like asking open-ended questions, affirmations, reflective listening, and summary reflections. And last, we know that the role plays are particularly effective when feedback is not only present and accurate, but it's immediate, non-judgmental, and accepting. So when you and I get helpful feedback, it changes the way that we navigate these role plays, which allows us to integrate that knowledge more effectively and into real-life conversations in this case. So Cognito has a growing wellness portfolio for K through 12, and a lot of our simulations focus on mental health and suicide prevention. A lot of vulnerable populations, such as military children, LGBTQ youth, and tribal youth. We have simulations that incorporate bullying prevention, substance abuse prevention and intervention, and that speak to trauma. And there's a lot of simulations here, and we're going to talk to some of them more in depth. But if you do have any questions about some of the simulations that are available that you will see as we continue this presentation, I'm happy to answer any questions. So here is the at-risk series for mental health promotion. And so the at-risk high school educators, middle school educators, and elementary educators. So here the learning objectives are to really recognize warning signs that a student may be suffering from psychological stress, including anxiety, depression, substance use, and suicidal ideation. Initiate a conversation with the student to build resilience and help the student to identify sources of support. And then the last what you want to do in this conversation is connect the student to appropriate support services. So although these simulations are broken down by grade level, you can learn different skills from each. So in the high school, we're focusing more on substance abuse and self-harm. In the middle school is more geared toward the bullying. You'll have a combo with the person being bullied as well as the bully. And then in elementary, the school features a combo with parents, which may teachers find quite helpful, since we found that often teachers feel unprepared in those conversations, as they can be a bit awkward. And so again, these are 3 different simulations for mental health promotion for high school educators, staff, middle school, and elementary. And we don't just encourage you to train the educators, we encourage you to train the staff. So the bus drivers, the cafeteria workers, anybody who's engaging with our youth throughout the day should definitely be trained with these simulations or any type of program that helps staff identify these early signs. And now I'm going to pass this back to Dr. Barges to talk about some of the supporting research of the Cognito simulations in American Indian, Alaska Native communities.
Great, thank you. Can you hear me okay, Sutton?
Yep, I can hear you.
Great, thanks. So we have published one study and have a number of unpublished studies that are in the various stages of publication that I'll visit with you about today. So the first study was published with a number of the simulations, participants from a number of the simulations. We had a total of 983 American Indian Alaska Native participants that came from 4 different at-risk programs. So we drew from the university and college faculty participants, from college students, from high school educators, and from middle school educators. And what we did was we gave individuals the opportunity to do a pre-survey. They completed the training, and then immediately after training requested that they complete a post-survey. And then 3 months later, we contacted them again and requested that they participate in a follow-up, 3-month follow-up survey. And basically, we got a total of 86 matched pairs, which means that we had pre, post, and 3-month follow-up data on all of those individuals, so we could really look at what was happening over time. And you could see the breakdown there on the slide on where those were coming from. Most of those were coming from the college faculty. And what we found was that the 86 matched pairs showed significant increases in self-identified gatekeeper attitudes of preparedness, likelihood, which is behavioral intent to intervene, and self-efficacy to engage in helping behaviors among their peers that might be at risk. And that really, those helping behaviors are, identifying those in psychological distress, talking to them, and supporting a referral for services. And so we saw those significant increases occur 3 months after training. We also looked at satisfaction of the learner experience, which is also very telling. And what we found were for those American Indian participants, 96% said they would recommend the training to their colleagues. 91% said the program was based on scenarios that were real, relevant, and 80% of the students said that as a result of this course, they themselves might actually go get some help. So what we learned, at least from the student participants, is that that it may increase help-seeking behavior and address mental health stigma for those that are taking it themselves. I do want to talk briefly about a few unpublished studies that are in the various stages of publication. We do have one manuscript that's already been submitted looking at college students, and we had a much larger sample there, but we were able to do random assignment. So college students were randomly assigned to be included in a waitlist control group or a training group, and we found similar findings with significant improvements in preparedness, likelihood, and self-efficacy to identify signs and symptoms and talking with at-risk students. And then we also have data now for the elementary population or elementary teachers, which are showing similar results for American Indian teachers, as well as for middle and high school educators. There are some, we have learned a lot in terms of tribal application and application to indigenous communities. We definitely have recognized that it is helpful for, particularly for the American Indian teachers, is where we've got a lot of the data on that population. But again, also recognizing that with the students, it's being helpful for the college students particularly. It also includes multicultural avatars. So, one of the challenges we have is we really try to make it as tribally specific or as community specific as we can. And the fact that the avatars are naturally multicultural helps with that. We also identified that it decreases embarrassment of the user by practicing skills as a virtual human instead of having to do role plays in a big group. And typically when you're doing gatekeeper training, you have to do role plays if people are going to learn. I mean, role plays are one of the most important learning components that you can't really skip, and it's got to be a really good quality role play for it to have any application value. And so one of the things that we know is that many of our community members may get a little embarrassed about doing that role play, and it really helps with that. And then the fact that it doesn't require a real human person to play the role of a suicidal person during the role plays is also an added value, as many of our communities believe in the power of energy and the power of words and of thought, and if someone is playing that role, it might impact them and other things. So that's another pro to this. The cons or the challenges is it's really newly implemented tribal-wide. As I said, I met Dr. Albright, who's one of the founders of Cognito in 2009, and we started this effort to try to get these simulations accessible, and it took us many years to get there. So so now this is a new process for us, but we are learning a lot more in the last few years about its usefulness and the adaptations and things that needed to be made. There's also, for the simulations that are developed for multicultural avatars, there are some cultural nuances that you may need to account for. For example, on the at-risk for high school educators, it teaches the educators that a youth that doesn't make eye contact might be a risk sign. Well, for some tribal communities, not making eye contact is a sign of respect, and it's not a risk factor. So in that case, you would need to do that kind of education locally because it may not be culturally appropriate in terms of a risk. So that's one example. So we've been learning a lot about the tribal applications, but generally our finding across, and you're going to also hear about the trauma-informed policing, which is the first simulation that is specifically targeting tribal populations. and you're going to hear a little bit about the data from Sutton on that simulation. And so we're finding that it definitely has the application ability to apply to tribal context and to the urban Indian health context. So I'm going to turn it over now to you, Sutton, to talk about some of the freely available trainings that are there.
Great. Thank you, Dr. Barges. So with our partnership with Indian Country Child Trauma Center, who was acting as OJJDP Tribal Youth Program TPA Center, we were able to bring a few simulations freely available to all of Indian country. And through this partnership, we were also able to bring Friend2Friend to a mobile app. Now these simulations are freely available right now until December 31st, 2018. Now that may change, and we can talk about that at the end of the presentation on how to get updated on when those simulations will expire, again, as that date may change. So Friend2Friend Mobile and Trauma-Informed Precinct Tribal Youth are freely available under this organization. And so Friend2Friend, again, is available in the App Store. And so it's designed for youth ages 14 to 18. And the learning objectives here are to decrease stigma and correct misconceptions surrounding mental health disorders, increase awareness of mental wellness and of signs that appear might be suffering from psychological distress, including suicidal thoughts. And last, you'll learn best practices for approaching friends that might be suffering from psychological distress and referring those students for support. So youth are able to go into their app store, whether that is for Android or iPhone, iOS, and download Friend2Friend at no cost. This is about a 20-minute learning experience. So Dr. Fowler, if you could go ahead and press play on the video, we're going to show you a trailer of Friend2Friend.
I chose Friend2Friend, designed to challenge. Friend2Friend is an online mental health and suicide prevention simulation to ages 30.
Dr. Fowler, I'm not seeing that on my screen here. Dr. Barges, are you seeing this playing on your screen?
No, I'm not.
Use effective techniques to talk with them and motivate them to connect with a trusted adult for support. In the Friend2Friend interactive experience,
Dr. Fowler?
Anna and Michael,
We're not seeing the video playing on our screen here.
and they practice what to do when they're concerned about
I am seeing it under the Meet Our Presenters on the right-hand side. But,
Oh, okay.
practices leading a conversation with Anna, who's showing signs of distress. Virtual Anna reacts like a real person, accepting or rejecting Michael's attempt to talk with her based on what the learner chooses to say. Meanwhile, the learner receives real-time performance feedback. With over 10,000 teams trained to date, Cognito's Friend2Friend is the program of choice for schools, districts, on mental wellness. By engaging teams, Friend2Friend shifts their attitudes and equips them with the power to take charge of their own mental health as they learn to help a friend. In addition to a state-of-the-art learning experience, Cognito simulations are easy to implement right in the classroom, a student club, or in an after-school setting. Friend2Friend includes hosting and technical support, usage tracking, surveys, and program customization. To learn more, contact us or visit our website.
Great, thank you. Today you can kind of see a demo of how these simulations work and how you take the role of the avatar and choose what you want to say, and the response that you get can vary depending on what you choose. A very interactive platform that youth really like to engage in. We had the opportunity to attend Unity this year with Friend2Friend, and we had a booth that was highly successful, and the feedback was very positive for Friend2Friend, very engaging for the youth. So again, to access the simulation, you're going to go ahead and create an account if you're online, but if you're downloading it on your phone, you're able to just go into the App Store and download it by choosing Indian country as your option and selection. So now I'd like to talk about two programs that were developed in partnership with the Robert Wood Johnson Foundation. So Calm Parents, Healthy Kids is a great simulation for parents. So as a lot of you know, early childhood is a critical developmental period during which strong parent-child bonds can have a major impact on lifelong health and well-being. Yet parents at this time can be incredibly challenging. Young children are still learning to follow directions, be patient and wait their turn, manage their emotions, and understand that adults in their lives. It takes practice to develop the patience and calm to manage stressful parenting situations, which is key to the healthy social and emotional development in childhood. So in this simulation, you'll play the role of a parent and learn how to be responsive to your child in a calm and loving way during a series of common situations for parents of 2 to 5-year-olds. This scenario includes managing your child's behavior on the playground, in the supermarket, while you're on the phone, and when you need to leave home on time. And to access these simulations, you'll go to conversationsforhealth.com and you'll be able to access them at no cost. Additionally, another program that was created with Robert Wood Johnson Foundation is Building Family Bonds, a virtual home visit. So the simulation builds the skills of family support providers to coach parents of children ages to 2 to 5. And we know that one of the most important goals for family support providers when working with families during a home visit is to give parents the skills and motivation to use what you teach them when you're not there. So in the simulation, you'll play the role of Sarah, a family support provider, decide what to say to Christina, the mom, and her 2.5-year-old son, Oliver. As Sarah, your goal is to coach Christina on how to read with her son in a way that will work for her. So again, it's the same platform where you choose what you want to say to the avatar, and the avatar will respond to you like a real human with personality, mood, and memory. And again, to access the simulation, you can go to conversationsforhealth.com and access it at no cost. So our simulations have been adopted throughout the United States, our K through 12 programs. And so I want to speak to the simulations that are freely available through our contracts with other states. So please take a picture of this. I'm not going to talk to every simulation that's available, so if you have any questions that you see as I go through these slides, please write that in the chat. I'm happy to answer any questions you might have. These slides will show you what simulations are available per state and when those contracts expire. So for Oklahoma, you're going to go to ok.cognito.com, and that's how you will access the at-risk suite simulations. For Montana, so you've got the at-risk simulations as well. Now these courses are available to all Montana educators, school staff, and OPI partners through the Learning Hub. This is a clickable link. If you have any questions on how to get through that module to complete the simulations, again, ask any questions in that chat box. Now Hawaii, we have simulations for the at-risk suite, and we have Step and Speak Up, supporting military children, and Friend2Friend. Now to access Step and Speak Up and Friend2Friend, you have your URL that you will use and your enrollment key from creating an account. And Maryland, so there's a lot of simulations here. Again, if you have any questions, let me know at the end of the presentation. Feel free to take a picture of this. And to access these simulations, you will be going to md.cognito.com. And Colorado. So we have more of the healthcare simulations here, which we didn't discuss too much in the beginning, but again, I'd be happy to discuss if there's any questions pertaining to these simulations. And to access these simulations, you will go to pas.cognito.com. And Nebraska. So Nebraska also has the at-risk suite that we spoke about, and to access these simulations, you'll go to nebraska.cognito.com. And if you're having any issues on trying to access these simulations, there will be an email at the end of this presentation, and we're happy to assist in any questions that you have or any technical support that you might need in accessing the programs. And then last, we have the citywide access. So the District of Columbia has a contract with us the Atlas Suite, and then Step and Speak Up, and that is at supportdcyouth.com. And New York City also has a contract with Cognito for the Atlas Suite and a bullying conversation called Building Respect for All Conversation Skills. And you can go ahead and access these programs at nyc.cognito.com. And last, so as Dr. Barges kind of spoke about, we do have a simulation that is culturally tailored, and it is the first culturally tailored role-play simulation of its kind. So it's called Trauma-Informed Policing with Tribal Youth, and it's an interactive role-play simulation, and it teaches about the effects of historical and intergenerational trauma on tribal youth, and it builds skills for leading positive police-youth interactions. So the goals in this simulation are to recognize trauma and trauma responses to de-escalate situations, connect traumatized youth with resources through systems of care, and reduce recidivism through early intervention. So our vision here is to make trauma-informed policing the new norm in Indian country. We believe that trauma-informed policing can have a profound and beneficial impact on the safety and well-being of tribal youth. Now, law enforcement professionals can take this simulation and they can earn 1 hour of CEU, continuing education units, either with IADLES or with CLEAP, and that is a accreditation that is specific to Oklahoma. This is about a 30-minute culturally tailored learning experience, and it's gotten amazing feedback throughout Indian country. And currently, speaking to the preliminary research, we have a study that we were working on that has 225 matched pairs. And what we found is that the simulation results are very statistically significant. Law enforcement professionals, we've seen an increase in skill, self-efficacy, and behavioral intent regarding trauma-informed policing techniques at the pre, post, and follow-up. Now, we are currently in the manuscript phase of this research, and so it's very exciting, but the evidence, again, is very, very promising, and we're looking forward to publishing this research soon. So again, as Dr. Barges went through the training satisfaction with the at-risk simulation, we have something similar here. So with the law enforcement who took this simulation, 97% would recommend the simulation to other law enforcement professionals, and 98% would recommend the simulation to cadets learning to become law enforcement professionals, and 95% of users rated their preparedness to refer the youth to mental health services as prepared or very prepared. Now this is some usage in different tribes throughout Indian country. So I just wanted to kind of highlight the usage that we've seen in different tribes throughout Indian country. Now, there are a lot of tribes, I want to say over 85 different tribes that have used trauma-informed policing, as well as other simulations that Cognito has to offer. And now I'd like to open it up to any questions, unless Dr. Barges or Dr. Fowler have anything else to add to this presentation. And again, thank you all for being in attendance.
Thank you, Sutton. Dr. Barges, did you have any closing remarks at this point?
I just wanted to thank NCUI for your effort to get the word out to the urban programs. You know, I know that we worked really hard for many, many years, and NCUI was a part of those efforts to ensure the simulations could become available. And it did take us some time, and now we're in a situation where we do have simulations available, but we're not sure about the certainty of them for the future. And as Sutton has said, particularly the Friend2Friend, which I think is very applicable to youth, tribal youth living in urban areas. That simulation, you know we've got availability through the end of the year, and it's very important that we all work together to ensure that your communities can continue to access those simulations. What we've learned is that refreshing skills is really important. So even if your youth accessed it before the end of the year, you know, repeating that on an annual basis helps reset them and refresh their skills in motivational interviewing. We did learn that from a tribal pilot site who has now been using those simulations for, I think, 3 or 4 years now, and they repeat it every year in the tribal school, and it's been very effective in helping to ensure that those youth skills are sharp and that they're able, and we're seeing effects in that local community where the youth are becoming peer advocates and helping one another access trusted adults. So it's very important, I think, as we look to the future, that we are all working together to ensure that these, not only these simulations continue to be accessible, but also we can continue to build new ones that are really effective for serving your communities.
Thank you, Jamie. I do appreciate both Sutton and Jamie for the presentation and giving the information on the accessible simulations. As Jamie mentioned, and I believe Sutton did also, that some of these simulations are going into exploration. It looks like based on your state that kind of varies as far as your ability to assess those, and especially most significantly that I think is appropriate for a lot of our programs and youth serving after-school programs that a lot of our urban inner health programs have is the mobile Friend2Friend app, which will be expiring in December. So I do ask that if you are interested in assessing that you go ahead and do so and become a little familiar with it and pass that on to others that you may know, so that they can also take advantage of this situation in this time-limited session that we have. We do hope to advocate for continuing the use of the mobile Friend2Friend in any way that we can to make sure that it is accessible for all tribal communities. As shown here today, there's been a lot of really positive outcomes and impacts from the use of these virtual simulations. And we know that taking away some of that stigma of conversation, as Sutton talked about, and communicating with people face-to-face, these simulations seem to be really geared towards lowering some of that fear and some of that hesitancy that people might have in speaking to others. So please be on the lookout for additional information of NCUI's ways in trying to support the retaining of these applications. I did want to see if there were any questions from any of you all that are on the line. Thank you for your attention during this webinar. And if you do have a question, please feel free to place that into the participant chat pod, and we'd be happy to answer any of those.
Absolutely, and if there are any questions that you might think about after this presentation, feel free to email info@cognito.com if there's any questions pertaining to any of the access statewide or citywide. We're glad to help you access those simulations and help you to get those uses.
Thank you, Sutton. And I have placed the contact information for all of the presenters up, as well as to Cognito. I would like to add that if you are interested in obtaining the slides for this presentation, they are available for download in the presentation slide pod, which is on the right bottom of your screen. We'll also be sending out a follow-up email that contains that presentation also if you're not able to do so at this time. And just one more few seconds, if there are any questions. I'd also, lastly, also ask that if you are able to take some time to give us some feedback on this presentation, we would appreciate that by taking the SurveyMonkey evaluation that we have that's in the chat pod. You'll also be able to access that at a later point in time too. It's always really helpful to understand if there are other areas that you would be interested in hearing back about from NCUI when it comes to the resources and trainings that we provide, but then also trying to understand a little more about your thoughts on the presenters and the subject matter would be of great interest to as well. We do have one question that is asking or stating that although access may not be freely available at the end of the year, can an organization negotiate a contract with Cognito to access for their organization? And that's a great question. Do either of you have an answer to that?
Yes, that's a great question, and the answer to that is yes. So if you are interested in contracts with Cognito and licensing any of our simulations, that is something that we are happy to work with you on. And again, you can send an email to info@cognito.com, or you can go ahead and go to cognito.com and ask for pricing or a demo from whichever simulation you are interested in licensing for your community.
And this is Jamie. I would just like to add to that. You know, one of the things that we really work to do is to try to do our best to make them as free and open access. The reason is because with our small user populations, like we have such small user bases that the cost effectiveness is not there for a small tribe or a small program. And, you know, if you're a large program, you've got a large user base, then it might work it out. You know, but in terms of the cost for that is difficult. Now, with the available simulations, you might find it works. So I would encourage you guys to reach out to Cognito if there's any of the simulations that you would like. One of the simulations I know one of the tribal communities really want to access to but doesn't have it yet is one that was developed out of the Southwest for teachers on how to support LGBT youth that might be being bullied in school or in the community. There's a lot of simulations. I would encourage you to go check them out and certainly check to see what the pricing is to see if it could work for your user group. And in the meantime, we're going to continue to work to try to see if we can find other sources that could make them more available nationally. That way the user base is larger and it's more cost effective that way. So that's really our hope and goal. And I would encourage you to go ahead and give them a call.
Thank you.
Thank you, Dr. Borges.
Okay, well, I don't see any additional questions. But as was mentioned, contact information is on your screen. If you have questions after the fact that you'd like to have answered, please feel free to reach out to any of those listed. Once again, I'd like to thank our presenters, Sutton King and Jamie Barges, who have provided us with a wealth of knowledge on these simulations. And it's just a really great opportunity, even as if there are providers or individuals that are working specifically with youth to be able to pass this information along to them in order to get them in their skills increased in that knowledge. So with that, I think we will close out the webinar. Thank you again for your attention, and we look forward to hearing from you at our next webinar. Thank you and have a great day.
Thank you.
Thank you all.